Welcome to an allclickshelp.net tutorial. This is billing from note. Do you know how to bill from the note and bypass all the clicks it takes to go through these 4 items: the diagnosis tab, the visit charges tab, procedure charges, and the submission? Learning how to bill from note is a great way to reduce clicks in TouchWorks. So we have a test patient, and we're going to go into the note. We have a note that's predominantly complete. Do a quick view of the note. We need to finish out this note and bill from the note, which will include adding a medication, administration, getting a diagnosis assessed, and adding the E&M code. Using your acute diagnosis form. Using your acute diagnosis form is your quick way to add diagnoses. This may not be the most specific asthma code to use, but adequate for our training purposes here. So I add the asthma diagnosis. Then I'm going to add the medication administration. Usually I would go to the problem-based orders, but this test provider does not have the DuoNeb there, so I went straight to the medication administration. And your DuoNeb is under the ipratropium albuterol solution, right? Because I had added that diagnosis, it's already going to link to that. And I'm going to give that DuoNeb now. And then save yourself some clicks by ordering whatever else you need to order at this point. If you were going to send them for a chest x-ray, do a chest x-ray, or just, you can have them come back in 1 week. So here's the key part for billing in note. You might be tempted, before you've committed this diagnosis, to jump to visit codes, but that's the one area that you do have to do first. You have to commit your Magenta diagnosis before you click on the visit code, so that it will properly link within what's called the charge summary. So along the bottom, this is the key little button that will allow you to bill from note. So I've got an assessment, got a plan that was done. Once I'm happy with my plan as far as what orders, what discussion summary, by having this all done before you click the charge summary, it's going to allow you to both sign the note and submit the bill at the same time, in order to save clicks and time. So again, it's still where I'm at right now. I still haven't committed it. So get your assessed diagnoses in as soon as possible. Figure out your plan. Then you go ahead and commit that. And then now, having committed that, it's totally safe to use your E&M visit coder within the note, so that you'll be able to bill from note. So I now have added that code on there. This is also an appropriate time to add any of the quality items. Or if the nurse had already added those, or blood pressure codes. You do not need to commit again before going to the charge summary. You can, but now I can go to my charge summary. And in my charge summary now, I have that primary diagnosis. I have my office visit. I have the charge for the medication administered. And I have my quality codes. And so then right from this screen, I have the option to either save this, close it, and go back to the note. Save and close just doesn't remove anything, or if I had made manual changes, it would save those changes and then close the charge summary, go back to the note. Or I could go ahead and submit the encounter form, the charges, then I would still be able to work on the note. Or the best option that reduces, for every patient visit, turns multiple clicks into one click, is the submit and sign. So that I will have to submit and sign, and when I do that, I'm going to have to commit those final charges that I put in, but it will both submit the encounter form and sign the note as final, or give you your co-sign note task if appropriate. So submit and sign, confirm your note signature. You'll notice after you do so, it takes you to the billing area, but you're already done. That's just kind of, all you have to do is just jump back to the daily schedule. And so back on the daily schedule, I now have a $, and I now have a checked off note. So with one click, I submitted my encounter form and I signed my note, as opposed to your usual come here and you assess the diagnoses, but you got to click next. And then the visit, click next. Add on any procedures if needed, which we did the DuoNeb from the MedAdmin. Click next. And then have to review the screen and submit it. So that was 5 clicks, able to be turned into 1 click. Just knowing that once you submit and sign, it will try to take you to the billing area, which many times is good. You may need to quickly add on a procedure charge, an injection code, something that wasn't able to be billed from the note yet. And so you quickly jump to the screen, add it on, go back to daily, and it'll still be done. It's still quicker to use that billing from note charge summary option in order to submit those bills. All right, so just one more time, we'll look in that area. It's the charge summary along the bottom. You assess your diagnosis. Make sure you commit it before you start clicking on visit codes. Once you've committed your assessed diagnosis, clicked on visit codes and quality items, and you're happy with the way your note looks, you click the charge summary. You can make changes here. You can, let's say the nurse had the BMI code or in the primary or health maintenance. You can use in this area, you can change primary diagnosis. So that's a great feature here. It's even quicker than in the regular billing area. So highly recommend doing that. You can remove charges if there's something that wasn't appropriate that got in. You ordered an immunization that they refused. You can remove it. You can add charges by code here as well. Most of the time not. That would better off if you do need to add something. Just submit and sign and add it from the regular billing area. Once you're ready, you just click the submit and sign. Confirm the signature. Jumps you to the encounter form. You just go back to the daily schedule and you have your feedback that all is good. You have a finalized note and a $, ready to move on to the next one. So in the daily challenges of reducing the click burden of AllClicks, I hope that this allclickshelp.net tutorial has been of benefit. Stay tuned for more tutorials and have a great day.